Once a person experiences how much better they feel when they make these lifestyle changes, it's very easy to keep them going because they get it. You know, they really get it.
I want to zone in on one of your team members,
Yes.
Health coaches.
Yes.
So, you know, a lot of integrative
Yes.
practices employ health coaches. Your sister's a health coach.
Yes, my sister's a health coach.
And a lot of our IIN grads go
Yes.
on to work, you know, in practices like yours.
Yes.
And, you know, we like to think that, you know, health coaches are really bridging that gap between the advice that you give and the actual implementation.
Absolutely.
What do you think is the biggest advantage of a doctor-health coach collaboration for a patient or a client?
Well, I think it's mandatory to have somebody, as a physician, it's mandatory to have somebody in your office that you can hand the patient off to support them. Because the how-to part is, it's everything, you know, and so that's the role that a health coach plays in terms of helping the patient, you know, or the client, you know, understand how to do it and to cheerlead them and to support them and to help sort of coach them through those roadblocks that are inevitable. You know, and especially there are some people that really need long-term support, you know, navigating, maybe they have a health condition or maybe they have diabetes even, that, you know, and they're very overweight, and that's a long-term sort of program that people need to be on. You know, some people have short-term needs and goals, and some people really, it's going to take a year or two, you know, to really keep them going, you know, with their lifestyle change. Lifestyle change is difficult.
It's hard.
It is, and but I'm not saying that it can't be done.
It's
and
not
actually,
impossible.
what I find is I don't want people to think it's too difficult to be done. It's difficult at first, but what I find is that once each person discovers for themselves how much better they feel. So my job is to get started right away with the help of my support team to create an aha moment. I want you to say, oh my gosh, I can't believe how much better I feel within the first month or two of working together, like right away. Because if you can help somebody feel better quickly, that way, and as you know, changing your diet has that power. If you can get someone on board to really make those changes right away and to stick with it for that first month or two, which is easy to do. I mean, really, I find that with motivation, education, and enough support people to guide them, and that's where the health coaches come in, and this is why doctors need people to help them implement these things. But once a person experiences how much better they feel when they make these lifestyle changes, it's very easy to keep them going because they get it. You know, they really get it. And so it's really important that we work quickly and effectively, you know, to help people notice the change in themselves. Because that's always where people have to start.
Yeah.
And once they notice the change in themselves, it's easier to keep going. Before I opened Blum Center and I was by myself, and I didn't have these people, the support team, to help my patients, it was very frustrating, you know, because I would tell them I want you to eat this way, and they're like, well, how do I do that? And I'm so frustrated. You know, they were confused and they needed the hand holding. So that has made a huge, huge difference. And I think that without that support to help implement, you know, the changes or to support people through the changes, I don't think the program is going to be as effective. I think it'll be harder that doctor word, compliance, which I really don't like, because it's really, we don't like that word anymore in the medical field because it's a blame word. So, but there is an issue with compliance if you don't give the patient the tools that they need to succeed. So that's where I love the health coaches come in. The other role that I see for health coaches is in the kitchen. And that's one of the things my sister has done brilliantly, and we talked about in one of our sessions on camera, is really providing the food education in the kitchen. Cooking classes, hands-on, going in people's houses, pantry makeovers, showing them sort of how to be in the kitchen and prepare food, and understanding the health supportive nature of that. And so it's not just about going over a food list. You know, it's yes, the nutrition piece is important, but I have found the next step need. You know, there's the practical need. There's a lot of nutritionists that are dietitians that just, you know, sit down with people and go over what they should eat. the practicality of it is they need to get it then in the kitchen. They need real practical sort of how-to. And so I love, and I feel that IAN graduates come out with that knowledge, the idea about food, really being in the kitchen, and food preparation. And it's a place to go, to really be helpful. And so, so I love what my sister did with that, and I do see a lot of IAN people that come to me and say, I'd love to work with you, and most of them are in the kitchen with their clients. And so I find that that's a niche that's really important and good.
What would you say to another doctor who came to you and asked, Dr. Bloom, I want to hire a health coach, where do I start, where do I go? What kind of tips or help would you give someone like that?
I would send them to IAN to post for the job, and to, like hiring anybody else, make sure they're a graduate and see what experience they have already, working with clients. And I think that for an IAN graduate who's looking for a job in a doctor's office, to just get some experience on your own, which IAN is very good at coaching people how to get started on their own. And like my mentor Jim Gordon says, you start with yourself. So if you're first coming out of IAN, or you're out there doing this already, you work with yourself, you figure it out for you, you work with your family, you work with your friends, just work with everybody and you can do it for free at first until you feel really comfortable, and that's how you expand outwards. And if you're a doctor, then it's like interviewing for any position. You look for someone with a credential, and then you interview them. And you decide what kind of skill set you're looking for. If you want somebody that has kitchen experience, then find someone who has kitchen experience. A lot of people can go into other people's homes, into the kitchen. You don't have to have a kitchen in your own office. My health center, I built a kitchen, so I have a teaching kitchen on site, but you don't have to. If you're a doctor and you want to provide that kind of education, you can set up a little demo area in your office. You don't need an actual kitchen to hold these sort of pantry makeover classes in the waiting room in the evening. It's actually quite easy to do that. And like I said before, a lot of people like going into other people's homes.
Right.
And I know that that's something that IAN grads do all the time. So going into the kitchen is great.
So you think then the future for health coaches in the healthcare field looks bright then for the future?
I absolutely do. And part of the reason that I know this is that there's a new medical specialty called the American College of Lifestyle Medicine. Now, I'm board certified in preventive medicine, and so I'm a member of the American College of Preventive Medicine. About 2 years ago, maybe 3, there was a new subspecialty that was created called the American College of Lifestyle Medicine. I mean, how great is that?
Right.
It's in the conventional world. And I went to one of the annual conferences, I think I went to the one last year, and they were talking about nutrition, and they were talking about food. And so doctors are coming out of the gates now to really focus on and to understand the importance of nutrition. And therefore, there will be a place for people to help support that movement and to support sort of the nutritional medicine sort of approach to treating chronic illness. And we need people, to help teach people how to do it.
Yeah.
We can tell people why they need it, and we can make sure that they are given that service, but then we need the how-to people. And so, yes, I think the future is definitely bright.
Great. Well, thank you so much. That was so helpful.
You're very welcome.
All your information was great.
Thank you for having me.
Okay.
While doctors are trained to diagnose and treat specific illnesses, they are not trained in how to change the behaviors that lead to them. Now, a new breed of healthcare professional is filling that gap and working with patients in the weeks and months between their regular doctor's appointments.